So with my little girl, came into my care when she was three months old. She's 22 years old now. Getting Annika's diagnosis, it helped with the uncertainty that I had. You know, my thing was, why was this happening, and is there a cure? And if there's not, then we just have to live with it and deal with her and work with her. And it's important because if there's a way and that you could stop the reoccurring thing happening, it's good to find it early in lines of family. And yes, so they can talk about the problem and the things that they've experienced instead of keeping it in and bottling it up and not knowing where to go and who to talk to. So for them to be encouraged to go and see the doctors and see the genetic doctors is very important, because otherwise they just live with it and just continue on in life thinking there was nothing I could do and there's nothing I can do, so I'm just going to just have this thing in there, or have the problem, you know.
I am a person that my family come to for a lot of opinions and a lot of help, and it sort of gave me a lot of knowledge how this disease affects my family. For myself, like as I said, like I didn't know what my mother was suffering from, and I started becoming a health worker and started to learn about MJD. But now I've learned a lot and I'm learning more, and it's a better way of doing it, because at least I'm learning something for my family to give back to my family.
The benefits of clinical genetic services for patients is to allow them to identify whether a disease they might have or their family member might have has a genetic component, and then to be able to either treat, prevent or do further tests to further investigate that condition.
My name's Julie McGaughran. I'm a clinical geneticist in Queensland. I think even just a few years ago we would be testing maybe one or a few genes at a time. When I see patients now, I might say to them we can look at 3,000 genes at the same time, and to be able to say that in such a brief period of time, it is incredible, and it's constantly changing, constantly growing. Even the tests that we did a few years ago, just by reanalyzing them with the data we have today, we can make a diagnosis that we couldn't make a few years ago. So for patient perspective, it's a completely different opportunity to actually access diagnosis quickly.
It's an area where we expect the benefits to grow in the future as we identify more conditions that have genetic causes and have appropriate genetic treatments. Now it can improve people's access to treatment and care. It can mean that people who have conditions, even if it's not currently treated, can really access support services and information and other people to help manage conditions.
I think it's important for Aboriginal and Torres Strait Islander to access our service, because if there are concerns about their family history, if they've got concerns about the cause of conditions, then we're now able to offer testing to them, or at least diagnosis and assessment and understand their risk. And it's something that empowers them, that if you know you're at risk of a condition, you can seek medical intervention and reduce that risk. If you're not at risk, then it can alleviate your anxiety. So I think it's really important to empower families and individuals to have this information.
I would recommend genetic testing done, because having that knowledge of having something wrong in your genetics, you can find ways to work with that. You will find what testing you need to do to make sure that nothing goes any further than where it is. I believe that knowledge is power.
My father is of Aboriginal descent. He passed away a couple of years ago at the age of 65. He passed away 6 months earlier than my grandmother on my mother's side, who's non-Indigenous, at 95. You know, so my grandmother outlived my father. That's what the gap is. The gap is that Aboriginal and Torres Strait Islander people are dying almost a generation earlier than their non-Aboriginal Torres Strait Islander colleagues, partners, you know, family, friends. The promise that precision medicine has to offer us is that people within the next foreseeable future will actually benefit from precision medicine and live much longer. So in order to benefit from precision medicine, you have to be involved in it. And I think that's important to acknowledge, and I think that's important to recognise and do something about.
Once the services became available, we had huge demand for the services